Good afternoon, everyone. Am I audible?
Yes, Krupa, you are audible.
I think we can start now, ma'am.
Yes, please go ahead.
Yes, good afternoon, everyone. Very warm welcome to today's panel discussion on harmonizing social protection and locally led inclusive humanitarian cash transfer. I am Kripa and I work for Sphere India's collaborative advocacy program vertical and as part of protection and health sector committees. It is a pleasure to have you all in this important discussion on humanitarian response. As disasters grow in frequency and intensity, so does social inequalities and it becomes very pronounced. And there is an urgent need to rethink how humanitarian cash assistance is designed and delivered. Today's session, we bring together a pool of experts and practitioners from the protection sector to explore how we can better align humanitarian cash transfer with existing social protection systems and all the while ensuring that these mechanisms are truly inclusive, gender responsive, and locally driven. We are honored to have you all with us here, with us we have a distinguished group of speakers. And to guide us through this discussion, I'm very delighted to introduce Sphere India's Protection Sector Committee lead and moderator of today's session, Dr. Henna Ma'am. I'll quickly give a introduction of Henna Ma'am and then she can take it forward. Henna Ma'am works as the emergency officer at Change Alliance. She is a humanitarian and disaster risk management professional with over 17 years of experience. Ma'am has led multi-sectoral emergency and recovery interventions across India, Nepal, Bangladesh, and Kenya with a strong focus on gender, health, psychosocial support, and child protection. Henna Ma'am has worked with organizations such as ActionAid, ICRC, UNFPA, WHO, and Sphere India, championing inclusive and rights-based humanitarian action. Over to you, ma'am. Please take
Thank
the
you so much,
discussion forward.
Krupa. Thank you, and a very warm welcome to all the people who have joined us for this very interesting, very enlightening, session on localizing shock responsive, gender transformative humanitarian cash transfer. Now, this is a piece of study which we as Christian Aid, with a start support and with our implementation partner, the Dalit Bahujan Resource Center, recently did in Andhra Pradesh. And there were a huge learnings from this study, and this is further to a lot of things that are actually happening, in terms of the humanitarian cash transfers and in terms of social protection, not only within the country but outside. Globally, we have a lot of experiences. Krupa, if you could please help me put up the slides, I'm facing some difficulty. And so this study, there are two aspects to what we're going to discuss today. One is a social protection system, one is a disaster response program. So, with the evolving evidence at the national and global level of the advantages of bringing together social protection and disaster management, it's time that we in India start exploring how to test the feasibility of for such policy and project level integration. We have immense opportunities to link social safety net programs with disaster risk management contingency plans for climate related hazards. Early action could draw from pre existing database, from beneficiary lists, from bank accounts to garner greater coverage of vulnerable communities. Now, this also entails that we work collaboratively and in coordination with other stakeholders, primarily the government, the civil society, and other line departments, ministries, through a stock taking exercise. That's exactly where we are at the stage of taking this to a next level, doing some stock taking exercise with the local government in Andhra Pradesh and trying to see how we integrate humanitarian cash transfer and social protection. So, this report examines the feasibility of integrating cash-based shock responsive social protection programs within the contingency plans in India, and how to use social protection progress from, we must have heard about forecast-based financing before any disaster comes, predictable disasters, and immediately after those disasters. So we'll deep dive into that. But just to take you, can we have the next slides? Yeah. Krupa, we can have the next slides. Yeah, the next one. Yeah. So the context for this is humanitarian cash transfers have emerged as a critical response mechanism in crisis situations, offering affected communities immediate relief with flexibility in dignity. So, as I was telling you, this Bapatla district of Andhra Pradesh underscored the urgency of effective and inclusive cash based interventions. The deluge left 27 island villages submerged, with over 42,000 individuals displaced across 176 relief shelters. These vulnerable groups included Dalits, Adivasis, women headed households who bore the brunt and the crisis of this deluge. And this intervention not only provided immediate relief but also generated valuable insights into how humanitarian response mechanisms can integrate social inclusion and gender transformative approaches. Uh, Despite the increasing recognition of humanitarian cash transfers, there remains a significant gap in evidence regarding their gender responsiveness and local leadership. Existing studies done by many humanitarian practitioners indicate a lack of disaggregated data, making it difficult to assess whether these interventions effectively address the specific needs of women and marginalized communities. The limited role of local organizations in decision making further hampers the potential of these cash transfers to be truly context specific and empowering. Also, the understanding of the decision making power, which is the most important along the spectrum of the stakeholders, is crucial for designing effective, locally led, and gender responsive HCT. So, for this last point, which is there, if we can go to the next slide, there is a graphical illustration which illustrates the spectrum with power progressively shifting from international donors and agencies to local civil society groups and ultimately to those most affected by crisis. The degree to which the decision making is localized has significant implications for the effectiveness, efficiency, inclusiveness of the cash transfer programs. So here you see this, spectrum very widely illustrated, but very beautifully explained. So this also holds the surmise of localized versus locally led, which I'm sure some of the panelists will be touch basing on now. Giving the onus and giving the driving, making the local community the drivers of the change is what this study also deep dived into. And we had some findings. Can we have the next slide? Now, the objectives and the methodology adopted for this was, the objectives were largely around identifying the key learning gaps around gender, social inclusion, also assessing the impact of locally led cash transfers on women, on marginalized groups, and socially excluded communities. Also, this study reviewed the global and regional best practices on gender transformative HCTs, while as also looking into engaging with local stakeholders, including women collectives, women panchayats, CSOs, India Humanitarian Hub members, to document the community insights. The district IAGs, the public-private partners, even some of the government entities were kind of, interviewed during this process to have their insights captured. The objective was also to develop policy recommendations for integration, as we have already said, integrating gender and social inclusion into this framework, and to also produce an actionable framework for state and national level advocacy. The study. The methodology that was used is all illustrated here. We had 4 beneficiary households spread across 4 districts: Bapatla, Illoru, NTR, Vijayawada, and Vizianagaram. And focus group discussions, KIIs, consultations, and with women collectives, with CSOs and implementation partners were largely used to cull out the findings of this study. Can we have the next slide? Now, this slide is largely captured to capture some of the community consultations that we did with a wide range of local organizations, and seeking their inputs on some of the indicators, on localization also, and on gender equality and disaster response also, which were then further collated. Can we have the next slide? Did the response reach the vulnerable? So it's quite interesting to see, if we see the next slide, that among this survey which we did, 67% of the women headed households were largely looked into, and out of which 83% belong to the scheduled caste and tribes. And if you look at livelihoods, predominantly the livelihoods were unstable, with 72% dependent on agricultural wage labor and only 3% on salaried employment. Additionally, 84% of the households reported no land ownership. Low level of educational attainment, with almost 55% of household heads never attended school, and so on and so forth. Children's education also suboptimal. 44% of the households had children regularly attending school. For 18% households, child labor and migration as key reasons for irregular and no attendance. Only handful of households reported having crop insurance, and 9 in 10 fully exposed to the climate risk. What was also interesting to note was, in terms of the vulnerabilities, was that 1 in 7 families reported death of a family member due to the disasters, the floods primarily, and the cyclones, and 1/3 reported injuries primarily because of the disasters. 91% suffered damages to their to their houses, and 67% lost their primary sources of income. 97% families had to actually temporarily or permanently relocate, and posing more vulnerabilities in terms of their social safety nets, and rendering them vulnerable to mental health and gender-based violence. Can we go to the next slide? So in terms of the state response across the district, government also played a dominant role in both identification of beneficiaries and cash disbursement. What was unique about this response is that, after an initial precedent set up by the organization DBRC and providing an initial startup support, government supplemented the same support to all those affected beneficiaries, which was, which also spelled out the good coordination and complementarities between the two stakeholders. 85% of the respondents reported that their names were included through official channels. For example, in Vizianagaram, 97% identified government as the source of inclusion, and in Illuru, it was 91%. It also indicates that sometimes we have a lot of database and a lot of data available with the government, which at the right times can be complemented and can be looked at the time of disasters. Community awareness of humanitarian cash transfers in the wake of disasters was relatively high. Among the recipients, almost 69% reported receiving cash through government channels and 26% through NGOs. Can we go to the next slide, please? Now, the role of community leaders in designing of the humanitarian cash transfers. These are the percentages of the household who played multiple roles, not only in the identification of the households, but in the distribution support, the camp management, and somewhere they did not have a role to play. The next slide. addressing the adequacy conundrum. Now we'll talk about the variations next. We'll talk about the variations in the support provided, the cash support provided, which varied from context to context, state to state, from state to the NGOs. And this comparative analysis was also done to kind of draw upon how we can harmonize this and how this can be, as we set out, in terms of explaining how social protection can again integrate and harmonize into this kind of things. So these are some of the variations that were noted. But if we can see the bottom part in Joshimath, when during the emergency response, and humanitarian cash transfer of 8,000 per household was provided. But when we look at other locations, it might be less than. Government of Andhra Pradesh flood transferred 10,000 to the beneficiaries. And 40% of the beneficiaries under the study mentioned that the amount met all their immediate expenses. Next. Now, if we look at this was an NDMA NDMA Commission study, which was taken up by UNICEF last year to incentivize women's, assistance in post-disaster response. And they came out with these, the norms of assistance and the vulnerabilities faced by women. So, as per that, they came to a harmonized number of rupees 10,480, which was then it was also a part of influencing the SDRF norms, the State Disaster Relief Fund norms, and to also kind of to see how we can include other components also, and other vulnerabilities which are otherwise overlooked during disasters. Can we go to the next slide? Further to the last slide, this was to reinforce women's assistance, social protection, and leveraging the SDRF, NDRF assistance norms with a suggested 10,480, which was accepted as a benchmark for linking cash support with special provisions for women and vulnerable groups. Taken together, these figures for cash-based interventions between 8 to 10 to meet immediate households. So that was the last consensus, and which will align with both community realities and the policy frameworks. Can we go to the next slide now? Yeah, so we've already spoken about the integration of gender needs, and we all know how important and how we have these collective power of women in the communities, and how we need to engage them. And a substantial 73% of the surveyed women have played a crucial role in rural empowerment in they've been of the opinion that these have been vital enablers in the domain of disaster preparedness. So this is a huge untapped potential which we can, tap. And these are some of the missed opportunities. But institutional support for these groups, for these platforms, for these informal, unorganized platforms remains still very uneven. Can we go to the next slide? I think we are running short of time before we hand it over to the next speaker. But yeah, high women's participation in community groups, as I said, 73% women reported membership of self-help groups or women collectives played a very, very important, crucial role in the collective power, and instrumental in playing a crucial role in preparedness and response. Only 36% felt okay that this membership helped them access relief, training, and leadership opportunities. Next. Yeah, we will skip through these, but we will actually cover them through the responses by some of our panelists also. If we can skip some of these slides and go to these were some of the recommendations to the 16th Finance Commission and the policymakers Some of the broad top lines I will just run through. One would be the institutional integration of cash relief and welfare direct through direct bank transfers by creating policy provisions allowing disaster relief cash to be transferred through existing DBT schemes, linking disaster budgets to social registries to pre-identify and re-release shock contingent cash assistance. Second would be the mandate for participatory planning in PDNA. There was a lot of inputs even in the launch workshop in Andhra Pradesh, where people said that during the PDNA, this needs to be further institutionalized in terms of including women, including their participation, segregation of data in terms of the PDNAs and all of that. So allocating budgets for training panchayats, CSOs, primarily the female sarpanchs and the panchayat unions in the PDNA would be another recommendation. Revision of the STRF and SDMF guidelines, including the minor mitigation and recovery support like sand casting removal, providing guidelines and formula for one-time recovery assistance, shelter infrastructure and cash eligibility, and monitoring and social accountability. I'll stop here. We also have some slides on the way forward and the recommendations, but let us hear from the panelists first on their insights, because this would have set some initial thought process and some ideas from our very well informed panelists to kind of share their opinions, ideas, insights. So without any further ado, I will invite Mr. Syed Mohammed Aftab Alam, Head of Global Hunger Response and Resilience Unit, Plan International. Mr. Alam has been bringing 27 years of humanitarian experience across 70 countries. Since 2013, he has led the expansion of Plan's cash and voucher assistance portfolio, now exceeding all 250 million uh, pounds. He has previously worked with ECHO, Islamic Relief, UNDP, Caritas, DFID, and Government of India. His expertise spans CVA, humanitarian response, DRR, climate adaptation, resilience, and child protection. Aftab has also served as a co-chair of the Global Cash and Market Working Group and advisor to the IASC Global Cash Advisory Group. I know Aftab from the longest period during my tenure in SPEAR in the cash committee. His ideas, his insights, his suggestions used to be very, very, insightful and very helpful. I'll hand it over to Aftab. I know that he has some other pre-scheduled meetings, so he would like to kind of, share his perspectives in this meeting. Over to you, Aftab.
Thanks, Anna. Thanks for the very long introduction. I don't know I am deserved for that, but I can say this is a student of humanitarian and cash programming, I would say. The cash, something which I'm passionate for, but now I'm holding a position which is managing cash through a different team. So that's what brings me here. Thanks for this. I have managed to stay until 4 p.m. I just rescheduled some meetings so I can stay until like 3:55 or 5 to 4. So I have been asked to speak on two questions, isn't it? Could you please put the two questions there somewhere? Like how do we define, especially on the locally led cash, and also what are the innovative measures? I think I'm going to speak on this. But before diving into the topic, I want to break this jinx of cash. Am I audible, first of all, properly?
Yes, loud and
Okay,
clear.
fine. Thank you. So when we say cash, I think people sometimes raise their eyebrows. Or cash programming is it's very different, and it needs special attention. Of course, it needs special attention because when you implement any project, we don't define the modality there. So it can be in kind or material support, or it can be cash transfers, or it can be vouchers. So which we call it as a combination of cash and voucher assistance. But when it comes to cash and voucher assistance as a modality, then we try to say, or we tend to say that it's a cash programming project. I think that's where we make the big mistake, because cash is nothing new. Let me break this into small parts just to make it more simple. It's not rocket science. I think we use cash in our personal lives, isn't it? most of the people had their lunch maybe an hour ago or 2 hours ago, and you must have paid cash if you had cash outside, or if you had cash food inside your home, that means you must have purchased those grains to cook the lunch. That means you paid cash for that. I know Hena must be renting house in Delhi. She must be paying cash, isn't it, to the landlord? And people have protection policies, and you pay cash for that. May it be social protection, may it be medical provisioning. And people who have children, like I have children, I pay school fees. That is also through cash. And then, so if you connect these dots to the sectors, so when we have food, that is food security, that means we are using cash to achieve our own food security outcomes. When we pay cash to rent homes, that is, we're paying cash to achieve shelter outcomes. Similarly, for protection, we achieve for protection outcomes. And if you pay school fees, it is for education outcomes. So if you connect these dots in the personal lives, that we have been using cash from our childhood when we had senses to know what is cash. And we knew that, okay, this cash is meant to buy something at the market level and to meet our basic needs. And if it goes beyond the basic, it's the luxury or it is the desire. But we are talking about the basic needs here. So which means cash is not new to us. And the person who is speaking now, he was a negative cash person before getting converted in 2005 after tsunami response. So I used to be against cash, but when I realized that I have been using cash in my own personal life, and then when we go to the people which are working for, that is the most vulnerable girls and boys and men and women, then who are we to impose for their choices to be met or the basic needs to be met? So basically, they also use cash. It is nothing new to them. When you talk about locally led, of course, cash is not international. If you're talking about a country, a village, a state, cash is always there, right from the beginning, from the prehistoric ages. If you say they used to say Ana or Dhela, so that was the cash value. So it was there. So which is nothing new. So I'm trying to simplify things here. So which means cash was already locally led. It was never internationally led. Yeah. And when we talk about the global discourse and when we say, let's say India, we are using cash, that means India is now a locally led. When we talk about at the national level and we go to the district state level in Andhra Pradesh or Telangana, so we say it's a state led or it's a locally led. Again, for the national vis-a-vis to state, it's again a local. When we come down to a much lower level from the state to maybe districts or panchayats or block, again, it's called locally led. And when we go to beyond a certain level in the ground level, or then we say it's a civil society led or the community led, or it's civil society led by the women groups. So we talk about this all locally led. But again, sometimes we also have a bit of a confusion. What do we mean by locally led? So it's as simple as that. Wherever you stand, that's the local which you define it. If you stand in a block, that's locally led. If you stand in India vis-a-vis other countries, it's a locally led. As Hannah mentioned that I'm also a part of this interagency cash advisory group. That's where I'm representing all the INGOs in the global level through ICFA. And that's where we are trying to ensure the participation of local actors. And there the local actors are government, any national governments, or maybe any national NGO. So they are a part of that, and we try to we emphasize that they should be participating and they should have a say and they should have a voting rights. Because sometimes on the other side, on the bureaucracy, on the red tape, and sometimes we try to get the local agencies or the national actors, but we don't give them voting rights. That's a hypocrisy. So and we had been advocating personally. I had been advocating on behalf of the NGOs that okay, if you are getting on board the local agencies or national agencies, they should have the voting rights as well. And now at the global level, fortunately, we have 2 to 3 national agencies from Nigeria, from Turkey and other countries as well. So we have that now, which was missing earlier because they were there, maybe they were not able to participate or they were not able to travel to Geneva, which was a requirement, like people we had from Bangladesh and from other countries, but they never traveled. And that was all just like a compliance. We had them, but they never had any say on that or selection. Now coming back to this locally led, local government, if you talk about the faith even, may it be Islam, may it be Hinduism, you have also the cash transfers there. In Islam, you have the sadaqah or the zakat, where you give you take out your 2.5% of your income and give to the poor people who are most deserving. In Hinduism also you have this dan and dakshina. Yeah, that is also locally led. You give cash to them. When I was young and a child, I used to remember when we had this cyclone in India, super cyclone 1999. I was still studying at that time. And I remember the district government gave in my city an immediate cash transfers immediately after the cyclone subsided. And that was, if you put in a different terms and a terminology, it is called like a multi-purpose cash or it is an unconditional cash. Maybe the nuance was that, okay, the naming was not there, but maybe we have packaged those old wine in a new bottle now. Yeah. If you talk of beyond India, uh, you go to Philippines, you have different like panchayat levels, you have barangays. There they have also disaster risk management funds and they manage this funds locally so that they can use it. It's like a local cash pot and they can use it for small scale emergencies and immediate relief. If you talk about even Ethiopia, Laos, even they have also smaller funds at the government level, at the field level, and they try to support the people which were in need. So what I'm trying to say is that is cash is always local, but again it depends where you are, how you're giving the terminology and where you're giving this terminology. So this is largely to break the myth of cash is always locally led. Of course, we can bring in the value addition from the international platforms, from the global, like let's say digital. When it came for the first time, we said, okay, it is a new phenomenon which has come for the cash transfers. But now I think it is nothing new for digital. Digital is by default. Like when you go to any vendor, you buy any fruits even from a roadside, you pay through your QR code, but it was something which was very new, maybe 5 years ago. And we were not trusting that system, but now having used that, it is more of a local led now. It is like a local cash transfers. Even when you talk about now, again connecting to the global, um, you must have heard the President of America's decision to cut humanitarian aid, life-saving aid, which has a big impact on the funding and also the impact on the lives. As I speak, I think more than 4 million people will be dying because of that, because of the cut in funding. But what is coming out is that as a new reform is humanitarian reset, which talks about cash transfers. So which means this is going to stay, and whenever until we have life, I think cash is going to be used. May it be in the form of electronic, may it be in the form of virtual, but this is going to be used. This is not going to die. I was in South Sudan, 2 weeks ago, and I was interacting with the people there, especially the women group. And South Sudan, as per the UN report of 16th June, it is one of the top 5 hunger spots, which means there are more people on the verge of catastrophic level of dying of famine than other countries. Like the 5 hunger spots, top 5 are Sudan, South Sudan, Palestine, that is Gaza, and Mali, and we have Chad as well. So which means the majority of the population, like in South Sudan, around 7.7 million, are on the verge of IPC3, that is International Classification of Phase of Classification, or on the 4. And if you're not supporting the IPC3, and I witnessed a location called Rumbek, where we were doing food distribution and also cash as well through WFP, we observed that the people who were in the IPC3 in February, January, they have moved to IPC4 status now in June, in 5 months. So which means people are on the verge of moving to the more catastrophic level, and then the people on the verge of dying. And same thing is happening in Palestine as well. What happens is that what we also observed, why I'm saying this, when we went to the markets there, we saw all these food grains. People are hungry, people are not able to survive because of the incomplete food access to food, but they're selling this food in the market. That is a bit of a contradiction. Why? And I interviewed several people there. Why are you selling this? And also at the throwaway prices, maybe the oil is being sold at a 30% or 40% price, should be. They said the food which we are receiving is, first of all, it's not complete, it's not a food basket. And second, we have other unmet needs, basic needs, which is not addressed. So we sell this to cover all those other needs. So basically, that means they need a flexible money or flexible pot of money, maybe a mix of both food or material and cash, or only cash, so that they can meet their objectives or the basic needs in the marketplace. So what I'm trying to say is that maybe what we deliver is we are just imposing on them. We think that we are the most what do you say, the best experts we know, and of course we spend cash to meet our own basic needs. But when it comes to the people, we'd say, okay, you take this to the form of in-kind support, and that's where we do a big mistake and a big blunder. And then people tend to what do you say, reject our support, our support by selling those in the market, and then meeting their other basic needs, maybe health, maybe other food items, by purchasing through cash. So this is where it comes, and this is an advocacy as well to the local government, that when we talk about, and of course, I must say that I've visited at least 70 countries professionally. I must say that India has a lot of varied social protection programs. I think we should take pride in that. But only maybe the implementation might be an issue. I am not aware of the latest statistics, but it will be good to see that how best, if it is not happening on the ground, how best we can advocate this through our humanitarian response, so that those cash transfers can be implemented in a more efficient and effective way. For example, let's say the MGNRG scheme, which ensures or guarantees 100 days of cash transfers. But it is always a challenge, and maybe if I am a beneficiary, I may not be receiving the 100 days of cash transfers over the period of 1 year. Maybe I'm receiving 20 days or 25 days or 30 days. It depends. So which means there is an advocacy needed. There is also system monitoring needed at regular intervals, so that we can point out where are the gaps, where are the lacunas, and then advocate with the government so that it can be tightened or be made more effective. And if I recall well, when I was with my previous employer, ECHO, and we used to advocate with our partners that you should go for at least 50 days of cash transfer over the period of six months. That means if we are able to implement 6 months, 650 days in 6 months, that means it's an advocacy and also an evidence to the government that they can implement 100 days in 1 year. So this is one example, and there are several other social protection schemes. So having said that, I would say yes, it is always empowering and dignified to have locally led transfers. And how best we are going to do this? What are the innovative ways? I think the best process is, the trend is called anticipatory action. And I think this is also supported by different donors. And we have what we call it as a common donor approach, CDA. And this is also when I'm sitting in the Global Cash Advisory Group. This is also a point of advocacy to the donors and also donors to the governments as well. And that is where Plan as an agency, Plan as a global organization, we also emphasize the leadership of local actors as knowledge holders in vulnerability and risk dynamics, especially in the climate-related and anticipatory contexts. When I say this, let's say we are almost in the flood season now. We know very well that every year, unfortunately, Assam is going to flood. We know that is predictable, isn't it? And if it is predictable, so then why don't we go for maybe a better risk minimization or risk reduction by giving anticipatory action and through cash as well, so that people have less damage and they can move to a certain, can be facilitated to move to a better safe space and with some cash in hand, so that they can continue the basic amenities and basic needs covered until the larger support arrives. So this is what is coming up is one of the, the localization or the common donor approach on this. And second, we talk about this advocate for participation of women and adolescent girls in coordinating platforms and decision-making spaces. We also, I would recommend to integrate gender and child-sensitive analysis into feasibility assessments and response design. When we say feasibility assessment, let me break down into a bit of a smaller term, smaller portions. Like when we say feasible, it means, is it possible? So when we talk about this, generally after a disaster, major disaster, we see the markets do not function. But we have seen, even after a major disasters like earthquake in Nepal, we've been in tsunami, market started functioning after maybe 3 to 4 weeks. So which means market is very spontaneous. And sometimes we have to support the market as well. That's what we did in Nepal. On one side, we supported the markets through cash flow work to make it good infrastructure as a market. Second, we provided cash to the people who were in need, like multi-purpose or unconditional cash. And third, we also provided cash to the vendors because they were also the victims of earthquake. So that in that way, it was a three-prong approach. At that time, eyebrows were also raised. Why are we supporting vendors? But at that time, vendors had nothing. All the banks had also been broken or damaged. So which means we had to support multi-prong, and then the market started functioning. Even there was a gap, like there was a link road which is broken to the market. So people constructed through cash for work, the vulnerable population, and then we provided them cash. At some point of time, in cash for work, we give cash after that work is done. But as a proactive measure, because people needed cash immediately, the cash injection. So what was happening is that for the unconditional cash or the multi-purpose cash, people were receiving immediately, but for cash for work, they were waiting for 15 days or 1 month. So what we did as plan and other organizations, some organizations, we gave them advance with the trust that people will come back to work. So that is not so. See, people always say that we have regulations or guidelines, but the thing is that there is no theory. Whatever you do implement, it becomes an evidence, it becomes a theory later on, and people read about that, and that's what we do, and that becomes an innovation. Simple things which make small changes, and it becomes an innovation for the people to follow later on. I think I'll stop here. I don't know how much time I have to speak, Hina, but I think I have covered largely the key points in this, both globally, local, and the regional level as well.
Thank you so much. It is quite insightful. Thanks for demystifying the term locally led for all of us in very simple, straight language. Thanks for also talking about your global experiences and the need for this humanitarian reset. You briefly touched based on that and how important cash is going to be till the time we are alive. And you talked about the common donor approach, which is quite a new, innovative approach. Maybe we might want to discuss this with you, or maybe while we are devising the guidelines, we will seek your insights around that. You also talked about creating these platforms for women, for children, gender child analysis. You talked about establishing feasibility and how important it is. And at the end, you stressed upon, sometimes we develop these cosmetic guidelines, but they are not till the time whatever is applicable, whatever is contextual, whatever we do in our day to day, and whatever works in the communities, that is what we take as a good practice, and that is what we strengthen. Thank you so much. I will request any of the people who have any questions directly to Aftab, because he's going to leave after some time and he may not be there for the for the Q&A later. Just in case anybody has any quick questions to ask to Aftab directly, they can raise their hands or put their question on the chat box. Krupa, are there any questions on the chat box?
Not yet, ma'am. I think we can move forward, and in the open Q&A, we can take those questions.
Sure. Thank you so much, Aftab. And now we move to our next panelist, Mr. Mihir Bhatt. We all know him. He doesn't need any introduction, but still, I would give his brief introduction. He is the director, All India Disaster Mitigation Institute, a founding and active member of SPARE India, and director of AIDMI. Has pioneered accountability for the affected people since Gujarat earthquake of 2001. Currently is working on making amended National Disaster Management Act effective at community level and helping the SDMAs develop extreme heat management and anticipatory action roadmaps. Very, very interesting, Mihirji. As always, you are always doing something innovative and something new. So the questions that are coming your way are two broad questions. One, largely looking at the structural barriers currently limiting local actors' leadership in humanitarian cash transfer. And the second one, how can humanitarian agencies and government actors transfer decision making and operational authority to local structures without compromising accountability? I hope these are explicit. I'll also request Krupa to put them on the chat box so that you can refer to these. Over to you.
Thank you. Can you hear me clearly?
Loud and clear.
Good. I hope not too loud. No, it was such a pleasure to hear from Krupaji about this session being organized. And Hinaji, as always, you made it very succinct and focused. So what I'm going to do is answer these questions based on the NDMA UNICEF study in the background. Also, your micro study that you have done, if I may call it micro study, recently, and some of our own work that we are doing on cash transfer in 11 cities around extreme heat as we speak. So I'll draw from that. I want to make a side comment to start with about the micro study that you presented, which is, I think, extremely good and should be promoted far more. So if anything AIDMI could do, we'll be very happy to do that. But also, I think the participants here may want to, because the method is available and structure is available, participants may want to do more such studies in their respective areas so that there is more evidence to demand and request what we want to demand and request from the Finance Commission and the national authorities and state authorities. Having said that, I will do two things, respond to these two questions that I have been given. One is about structural barriers to local leadership, and second is transforming authority without compromising accountability. What I want to argue while answering these two questions is putting cash in local hands and strengthening inclusive and locally led humanitarian cash transfers in India. That's what I want to argue. And I will argue in 3 to 4 responses to both questions, so total 6 responses. I'll do it quickly to not take too much time. The question about structural barriers to local leadership, we found that despite their proven capabilities, local actors often find themselves on the sidelines of humanitarian cash programs. And the key barriers include, we have found, one is the top-down financing flows. The flows are slow, they are unclear, transfer of funds and responsibilities from the national to state to panchayat levels. So that's one barrier that we have observed. And also there is no provision for lateral flow of funds. That is funds given by an outside agency to the system directly to flow them down. That's something we think is missing, and that could be strengthened or that could be added to put the cash in the local hands. The second barrier is limited access to tools and data. There is a variety of tools and variety of data already available on cash transfer since actually Gujarat earthquake. And all of that is neither combined or built on, except the 2 studies that we talked about recently, to make it something which could be at a national level. So that is something that needs to be done in terms of standardized mechanism for damage assessment and impact tracking once the cash transfer has taken place. The third is about the under-recognized civil society capacities. Those civil societies' total money-wise may be far less than the government money that is being transferred or being used for disaster response. But the capacity and the variety and the solutions that they offer is really tremendous. We just saw the study that is recently mentioned. So I think from that point of view, and also Aftab Saab very clearly mentioned what is happening at a global level. There is nothing happening at a global level we have not done or cannot do in India. So keeping that in mind, the under-recognition of civil society capacities needs to be addressed quite directly by some directive, some advisory to the state authorities, national authority, by national authority to the district authorities, so that the local self-help groups, women's cooperatives, collectives, as Dr. Hinaji said, trade unions, cooperatives, workers' organizations, all of them could directly use cash transfer in a disaster situation. And the fourth barrier, we'll stop there, that we have observed is related to the coordination deficit, if that's the word I could use. Though there has been tremendous improvement in coordination, we have IAGs in each of the states, we have state level coordination committees set up, but still there is far more to be done. So fragmented partnerships and absence of shared operating platforms that are coordinated and cooperative. So those are the 4 barriers that I wanted to highlight. There are more we can discuss. You can either send an email to Dr. Hina or Trupaji. Will be very happy to answer that. But those are the structural barriers to local leadership that we see repeatedly coming up. The second question that I've been requested to answer is transferring authority without compromising accountability. And that also, I'll tell you what recently we have and I'm also drawing from the 2 studies that has been mentioned. One is NDMA UNICEF study, and the second one is Dr. Hina just pointed out. The first aspect I'd like to highlight is create local first cash policy framework. So framework itself should clearly state that the transfer of cash will be as local as possible in terms of putting cash in the local hands. If the framework itself is organized that way, then the taking of time through various levels may be less, in fact, can be short-circuited. And with the latest technology, you can directly do that to the bank accounts of the affected population. So create local first cash policy frameworks with clearly designated powers all the way to the affected population. That's one. The second is invest in local capacity and systems for bookkeeping, 2 grievances redressal, 2 paperless cycles. What is happening is that there is local capacity which needs to be consolidated, both administration-wise as well as by so that capacity needs to be invested, and that is something will cost to start with. Eventually, it will pick up, but that money has to come from somewhere, hopefully from the public exchequer. So that should be mentioned to the Finance Commission. The fourth, and I understand that when you transfer cash, there are certain capacities built. There are other capacities which we fear will be lost, but there is no reason why that should happen if the planning is done in such a way so that the cash transfer builds the money transfer capacity without undermining the other capacities that we have. It's a question of convergence, coordination, but I agree that needs to be addressed. The third aspect that needs to be looked at while balancing transferring authority without compromising accountability is scale through pilots to policy. So a lot of pilots that are being done and should be done even more, but learning from them, using real-time evidence to influence government norms at district level, city level, and state levels simultaneously. So that scaling through pilots to policy should happen more often and at a much larger scale. And that will make us one of the leading cash transfer economies of the world, if I may say so. And the last and the fourth one I'd like to mention is establish joint monitoring platforms involving state departments and affected community representatives simultaneously and in synergy. In Sphere, we have interagency coordination committees. We have district level also that is being done. So in that case, we may want to use them even more by making them platforms for establishing real-time and joint monitoring. So these are the 4 areas: create local first, invest in local capacity systems, scale through pilot to policy, and establish joint monitoring platforms, starting with IAGs. Those are the 4 suggestions for transferring authority without compromising accountability. I'd like to rest there. There are other questions that are there that we will be addressing. Should you have them, feel free to let Sphere India, Trupaji know, or Dr. Henna, and we would be very happy to address that. Thank you very much. I'm so glad this is being addressed. Thank you.
Thank you, Mihirji. Thank you for your comprehensive, succinct, some of these recommendations that we have taken note of and will feed into some of the recommendations and some of the guidelines that are being prepared. One good thing is that the government of Andhra Pradesh has been very open. In fact, the main director was there and throughout the launch event of the study, and showed a keen interest in actually asking us what could be the next steps. So we are working on the next steps in terms of devising some guidelines and SOPs at the state level first, because when we make it national level, India is a very diverse country, so we have to look into different contexts and we have to influence certain act. But the good thing is that it also has a keen interest from NDMA. Krishnavat was also a part of that, so that can be kind of looked into. You while stating some of the barriers, you talked about standardization of tools, and I was recalled that Spear also last time had captured, because there are a lot of civil society actors in India, and then there is a government of India tools, and there are too many tools sometimes for impact tracking. Like you mentioned the Gujarat earthquake specifically, and you talked about some tools that you are already in place. But I also remember that during uh, some years back, Spear was also trying to harmonize some of these cash tools, so putting them all together, harmonizing them, bringing a uniformity in them, so that reporting becomes easier and it becomes easier. I think you have flagged that, which is a very important thing, and it's also one of the recommendation to Spare, to kind of take it to a next level in terms of if there could be some work done around that. I understand that you've talked about the under recognition of the local organizational capacities, solutions, and the directives and advisories. I also know that AIDMI and ADRA are doing some work around that, which is also a good thing if some advisories are issued and also gets related to this. So there is some good, healthy, positive work already happening on this. And the only thing is that convergence, coordination, complementarities, and working together, it could be something where we could kind of optimize our capacities. Our next, Pam, thank you so much, Mihirji. And
Thank you
whoever
so
has
much.
any questions, yeah,
Thank you. I really appreciate it. I
yeah,
may not be able to continue too long. I'm using somebody else's office.
sure.
So, yeah.
Thank you so much, Mihirji. We will let you know if there would be any submissions from this meeting, and we would convey them to you. Thank you
I
once
thank
again.
you. I thank you. I thank Sphere, of course, Christian Ed, and all the participants.
Thank you so
Aftab,
much
thank you.
once again. Thank you. Our next speaker, a very young, a very vibrant young lady, and whose work I have watched, observed in multiple contexts, in very difficult contexts in India. She works, but yeah, I'm talking about Eshani Choudhury, who is the protection and project lead for ADRA India. And Ishani has over 10 years of experience in the humanitarian and development sector. She has been deployed in multiple emergency programs across India, including the Assam flood response, Cyclone Fani in Odisha, Tripura flood response. Beyond emergency interventions, she has also led projects focused on DRR and climate change adaptation. Currently, she oversees a regional protection response program in Mizoram with a particular emphasis on anticipatory preparedness initiatives. Her extensive experience in the sector has helped her build strong expertise in project management, core humanitarian standards, protection principles, meal, capacity building, and knowledge enhancement. Thank you so much, Ishani, for taking time out to be a part of this session today. And we hope to learn from you how this humanitarian cash transfer program designs can be restructured to enhance women's control, leadership, and agency. Over to you, Ishani.
Thank you so much, Dr. Henna. I hope I'm audible to everyone.
Yes.
Okay, yeah. Thank you so much, and good afternoon, everyone. And thank you, Sphere India, for giving me this opportunity to be part of this very important panel discussion. And hello to all the co-panelists, because I know they all come with extensive experience, field level experience, as well as their engagement at policy level issues as well. So I will be very briefly sharing about some of my reflections on how we can rethink and restructure humanitarian cash transfer programs based on my practical field experience, as well as some of the insights which I have drawn from secondary research. And I will be also highlighting on some of the key operational and contextual realities that I have witnessed in the course of my work, and suggest ways on how cash transfers can be more inclusive and enhance women's leadership and autonomy. So I have also just prepared a 2-slide presentation. So Krupa, if you could help me project the slides, because I am facing some issues with my system for the past 2 days. Thank you, Krupa. You can put it on the slide mode. You can go to the first. Yeah, thank you. So as I stated, I am also here to learn from the other co-panelists as well as the participants. So I would be happy to take questions during the Q&A session. But then here in this particular discussion, I would like to highlight on some of the important factors which which are like the precondition for, and which most of the humanitarian agencies have already been adopting, but how we need to kind of critically understand and analyze based on the contextual realities. So the first aspect that I will be highlighting is women as primary recipients of cash transfer. And we all know that most of the humanitarian agencies have been increasingly adopting this approach to enhance women's autonomy in deciding how cash assistance is utilized. And at ADRA India also, we prioritize registering women as the primary recipients of cash transfer. This is actually based on the understanding and also on evidence coming from the field, where we have seen that when women have control over cash, household food security, health, and education of children is always given precedence. So this is based on that, where the women are always considered as primary recipients. However, one important thing that needs to be looked into is that organizations should not be adopting this approach just as a strategy to tick some of the checklists that we kind of come up with while planning and implementing humanitarian response programs. So it should not be just limited to that, but rather a thorough risk analysis needs to be undertaken. So this should be accompanied along with the planning as well as the implementation, so as to understand the gender dynamics both at the community level as well as at the household level. So we have seen in some of the, I mean, there are multiple reports where we have seen how directing cash to women can also result in backlash coming from male family members, mostly from their partners. And this might actually kind of exacerbate the risk of, intra-household conflicts and affect the overall well-being of the families. So it is very important that as humanitarian actors, we look into this aspect and do a thorough risk analysis and have a nuanced and context specific approach, which is grounded both on assessing the pros as well as the cons of directing cash directly to women. Besides this, there is also a need for continuous feedback and monitoring of these programs, so as to ensure that these well-intended initiatives which are being undertaken by humanitarian agencies do not further increase the risk of the already vulnerable and marginalized sections of our society. So next, Krupa, if you can move to the next point. Yes. So the next point is again closely related to the first point. So there is a need to adapt real life context appropriate actions, which means that organizations should be mindful of using overarching methods. So when I say overarching methods, it means that, if a certain strategy or a certain approach, if it is applicable in a geography, it does not mean that the same approach will be applicable in like the similar situation will be applicable in some other context, be it within a particular region or be it at the national level. So there are multiple factors which actually impact how we how we kind of plan and roll out the modalities for assistance to the community. So this is where aspects like functionality of the markets and accessibility to the markets, as well as accessibility to multiple services, these are some of the preconditions which really help us in planning the modalities of support to the community. So based on this, it is also very important that organizations as humanitarian agencies, we explore all these aspects, especially whether, suppose if we are providing the cash, we have to see if there is a functional market in the nearby vicinity. We also have to consider the fact that whether the recipient have a functional bank account. So in multiple instances during my engagement with ADRA as well as with other agencies, I have come across such situations where we have registered women as the primary recipient, but then later on, when we tried to verify the bank accounts, we saw that the account was inactive, it was not functional, or maybe the situation was such that the family lost all their valuable documents. So in these kind of contexts, we have adopted a very flexible approach where, say for example, in Assam and as well as in the recent heat wave response in Rajasthan, we have adopted this cash in envelope modality. This was like a real-time pragmatic solution which the team came up, considering that we do not considering that the need to have a bank account does not pose an additional stressor to the family which is already distressed because of the situations, be it conflict or be it natural disasters. So this is one of the methods which we have adopted and which we have also seen being quite effective, though it also has its risk factors, and that is where there is a need to be very sensitive about the local contexts and have a very strict checks and balances set up at the organizational level as well as the local level. Coming to the next, we talk about localization, which is all, of course, the crux of the whole discussion today. So localization is something which it's a core principle of humanitarian action, and it must be pursued with a critical understanding of local power dynamics. So this is something which we have been emphasizing time and again. However, we need to be very cautious when we are adopting localization, because the power dynamics varies from place to place, and there are structures which are not participatory or which do not foster inclusivity within the community. So this might further reinforce discrimination, exclusion, and also misappropriation of fund, like the resources which are given. So it is very important that we try to look into the potential risks before laying the responsibility on the local actors, but at the same time also ensure that power does not go into the hands of a structure which is kind of reinforcing the hierarchical and hegemonic systems. So in that, another aspect which we really need to look into in localization is how we can strengthen existing networks. So existing networks, when I say, it should have a very gender balanced approach. So there should be a gender balance in all these networks that we are promoting and fostering. And at the same time, as humanitarian agencies, it is also important that we clearly communicate the objectives of our work, what are the targeting criterias, and what are the grievance redressal mechanisms that we are adopting. These are some of the points which we need to be really we should be given importance. And these are the steps which are very important before initiating any sort of cash transfer program. So also humanitarian actors, we need to be very vigilant to avoid any unintended negative consequences. So there is, commitment 3 and commitment 4 of the core humanitarian standards on quality and accountability clearly highlights on the do no harm approach. So whenever we are talking about localization, it is very important that we are strengthening the local networks rather than weakening them or uh, exposing them to more harm. Can you move to the next point, Krupa? So this is another point which another aspect which I have recently we have tested in the field, and this has proved quite beneficial for us in designing future interventions. So this is more of having a structured data collection system as well as documenting learnings and best practices from the field. So when I talk about structured data collection system, we need to understand that there is a pressing need to streamline data collection and analysis throughout the humanitarian program cycle. So, in most of the times, what happens is that data collection is something which we focus right at the planning stage and then towards the evaluation stage. But this is something which should be continuous, because the data collection tools such as household surveys and FGT manuals should be designed in a way so that it is able to collect maximum insights on gender dynamics, especially in terms of resource ownership and accessibility to the services, and also assess the multiple layer of vulnerabilities. So when I talk about multiple layer of vulnerabilities, say for example, when we are doing setting the criteria for beneficiary targeting, we have to be very particular that if we are talking about a single women headed household, we should be also in a position to distinguish between a women headed household with five, say, minor dependents and belonging to a socially backward family, and a women headed household with maybe, again, dependents, but in a better socially placed. So these are some of the aspects which really needs to be considered when we are doing the data collection and finalizing the targeting and criteria for the selection of the beneficiaries. Similarly, documenting learning and experiences, there should, it should be more related to our learnings as well as the challenges that we have been facing at the field level. So this can be capturing good practices or challenges and risk mitigation strategies that have been adopted by different organizations in different contexts. So it is very important to kind of contribute to the valuable learning resources so that we are better positioned to implement effective and context sensitive programming. Coming to the last point, complementary approach. This is again something which is relying on external factors, and in the wake of budget cuts, which other co-panelists have already highlighted, we are humanitarian actors as a whole are facing increasing difficulties in navigating through it. But this is something which is very important to sustain our efforts, because what I feel is that one-time cash support is not sufficient to sustainably enhance women's autonomy. So this is where, we need to have continuous support, continuous monitoring, be it in terms of health related interventions or be it in terms of livelihood related interventions, which can actually support and enhance women and promote them into the position as leaders of their community, and also help them in building their resilience. So these are some of the points which I wanted to present. Thank you so much for this opportunity. I would be happy to take any questions during the Q&A session. Thank you so much.
Thank you, Ishani. Thank you for putting up. I saw a lot of red flags, and that you have pointed out that are very, very important, that are missed in our kind of work usually. But thanks for listing them out so explicitly. You've talked about the need for doing these constant risk assessment, context analysis, gender analysis, power analysis, and to also talked about do no harm, how to establish quality and accountability in our work. But I have one question to you. I know that there would be other questions coming in, or some people might be dropping in more questions. But you talked about transferring funds directly to bank, female as the prime beneficiaries might sometimes be, land them into trouble also. But don't you think that recognizing women as primary recipients can significantly enhance their control and agency also? But how do you weigh between the struggles or challenges? Something that we can keep for the last. I think we're running short of time also. Let me invite Monisha. uh, I I would ask Monisha. Monisha is, I'm sure all of us know Monisha, some of the ones who are working in the humanitarian domain. Monisha is a humanitarian and development professional with over 3 years of experience at Caritas India, where she has led multiple disaster responses across the country. She has played a key role in mainstreaming cash based programming within Caritas India's emergency and DRR initiatives, ensuring these are community led, inclusive, and aligned with social protection systems. Her work focuses on linking anticipatory action, gender equity, and local leadership in humanitarian response. I see that she has recently come from the Himachal response, and she was doing a lot of capacity building of all these community people. But Monisha, the question to you is, what are the most critical roles that local governance bodies, you work so closely with them, whether they be the panchayats, the SHGs, the civil society organizations, can play in the humanitarian cash transfer program design and implementation? Remember, we talked about that slide which talked about, how the stakeholders, what should be their scoping, how do you see their role? And you talked about the recommendations to the finance commission. How do you see all these pieces coming together, especially with Mihir and Aftab talking about some of those the good practices that are also happening around, or some of the broad recommendations? Over to you.
Thanks a lot, Hannah. Thanks for the wonderful introduction, and thanks to Sphere India for thinking about Caritas on this particular question. So I'll be deriving most of my recommendations and learnings primarily from the work we do here at Caritas India. And in my work, in the years of my working in disaster response and Caritas India, I think one of the most important shifts I have witnessed is the growing recognition that local actors are not just logistical partners. They are the real system. And when it comes to cash transfers, they are absolutely essential. So we have been doing responses for over like 60 years now. And whether I refer to 2018 Kerala floods or I talk about the recent Wayanad landslides, I think everywhere we have seen that the success of any cash program doesn't depend just on how quickly we are transferring the money, but who holds the process is very fundamental. And time and again, that has been the panchayat leaders or the women groups. Sometimes we have also seen local faith-based organizations working and civil society groups very proactively working. These are the people rooted in the community who understand its nuances far better than anyone from the distance could ever. So their roles span across the project cycle, and it begins from understanding vulnerabilities. Because vulnerability is never just about what is the loss, what is the damage, how much was the requirements, and all of that, or data sheets. It's about whether a person is socially isolated, whether they have a support system, whether a woman has control over her bank account or not, like Eshani was just talking about. So, local governance actors help us unpack these various layers, which can sometimes be invisible to us as well. They don't just provide lists or some random numbers. They give us the context, they give us the background stories, they give us lived knowledge from the areas. So I'll take the example of Caritas India. We have institutionalized this system through formation of different committees, and I'm very sure most of our peer organizations are also doing the same. So from beneficiary selection groups, grievance redressal forums, and relief monitoring units. But the real value lies in what they represent. It's a shift from external aid to delivering like shared humanitarian governance. And one thing I've always appreciated is how these local authorities, the self help groups, step into their roles. They go far beyond what is expected from them. And in the most isolated pockets of India, they have helped like large number of them have helped neighbors navigate financial systems, whether it be education, helping them fill up forms, guide people in reactivating dormant accounts. So all of that, we see that the local people are doing it. The local governance systems. In some affected popular pockets of India, we had also seen that we decided to go with cash, and particularly in women's account, because we wanted the ownership to lie with them. Uh, and we saw a very big shift in behavior. How? Like during 2015 Tamil Nadu response, this method helped us understand the behavioral difference that women were more participatory in making small decisions. They were interacting with the masons. They were talking what kind of design they would want, which otherwise might not have happened. So giving them the right or the ownership of something made a lot of difference over there. Then there are also instances, for example, in Kerala, even recently we saw, whenever we do cash for work, we give the onus to the local governance people to select. And the best part is they helped us decide who needed the work most, contradictory to who could show up for work faster. So these are some things which only happen when you rely and trust on the local systems. And of course, it's not always perfect. We have faced pushback, especially when selection committees are influenced by local politics, or when documentation becomes a hurdle. Even local leaders can't solve at times. So, but this is where accompaniment matters, I believe, and we invest in training, co-planning, feedback sessions, so that the local actors don't just participate, but they can actually lead from the forefront. And what I have learned, and as an organization, I think we all are evolving, is that if we want accountability, we need to start with ownership. And ownership grows where there is trust, dignity, clarity of roles. In short, when local actors are empowered, not as implementers, but as co decision makers, cash transfers not just become faster, but they are more just. So, rest, I think my peers who were before me have covered very well. So, I will not be taking a lot of time. This was a very crux of how we have been working with the local authorities, and they have actually, in recent years, you can also be uh, I mean, you can also witness that in recent years, if you're working in the humanitarian setup, it's impossible to be able to working successfully or make sure you are reaching the last mile unless and until you have actually worked with the people at the local governance systems, whether a small CSO or it's a panchayat. So yeah, with that, I submit my case.
Thank you so much. Thank you. Quite succinct. And thank you so much for laying out these very important points, because that is the heart of our work. The more localization and the more local actors, you started with saying that we should hand over the levers to the local communities. And that ensures a very successive, a very qualitative, that builds trust, that builds dignity, and that builds all of these things that I'm sure all as humanitarian practitioners beautifully do in our particular work. One question I had for you, Monisha, with some of the questions and submissions that Mihirji also made out, that India's humanitarian response framework has traditionally relied on state-led centralized mechanisms such as the direct bank transfer system. Now when we are looking at the integration of social protection with cash transfer, and of course locally led, and local communities will have a larger say in that. But do you think that there are some limitations in terms of the who are the vulnerable, and how the government works, and how the local governance structures in the communities work, and how do you see this getting married to each other or harmonizing or getting integrated, because you come with a lot of field experience and know that where could be the plugs which can be drawn. Somebody talked about 100 days of work, right? Which can be given in the scope of maybe these many months, if something like that can be formulated. So how do you envision that thing happening? And because your question was primarily on the critical roles that these local governance structures will play, so do you think that there could be any challenges, or do you see that there could be a lot of opportunities in that particular framework?
So, Hina, I think the idea of making sure that the direct bank transfers happen and they are kind of done through these systems, it does make a lot of sense, and especially from my personal interaction with the DDMAs in Himachal as well. I think we could see where exactly there was a disconnect, but at the same time, they were the ones who also gave the solutions. And when we talk about bank transfers, I think even as an NGO that does bank transfers and relies on them because they are the most transparent way to transfer money to the program participants, we do see there's a lot of issues when the bank accounts are dormant, when they are not updated, or sometimes it also happens that people might have taken loans, and as and when the money strikes the account, it's immediately deducted, so it makes the purpose null and void. It's like no point. So these issues do make it difficult to do bank transfers in general, and especially if we are saying that the government departments are doing this and it will be channeled through them and all of these. It's a pretty good idea, but at the same time there can be a few loopholes like these where the process might take a long time. And when we talk, especially when we talk about 100 days of work, so coming from West Bengal, we have, like, I have particularly spoken to people in the Sundarbans as well, like, what is your idea about that? So people initially were doing it very proactively, but after some time they were not receiving the payments on time and things like that. So particularly when we are talking about immediate action and immediate response, I think it's a good idea to have very transparent systems through the government, but at the same time there's a good chance that there might be some delays and loopholes that are existing. And to make sure that doesn't happen, I think the NGOs could proactively take part in capacitating them, doing like telling them what could go wrong and what could work out well, setting up small kiosks where most of the people are not as educated, where they might need support. So facilitating the whole process, I think that would create a good mix of all of us being part of it.
Thank you. Thank you so much, Monisha. In the interest of time, we may have to skip Ishani's last question, but I would still take her answer. But before that, I think we have a guest who has joined us from, UK. His name is Matthew Tibot. He's ChristianAid's Global Cash and Markets Advisor, who has a decade of experience working in the humanitarian response. His role is to support the teams in and partners to implement cash and voucher assistance. He has experience working in several humanitarian and development settings, including South Sudan, Iraq, Libya, Liberia. He holds an MSc in Economic History from the London School of Economics and Political Science. I hope Matthew is here. Matthew, we would like to hear from you on your perspectives and your top lines from this session. And if you could also tell us a little about locally led and localized. And because ChristianAid does a lot of locally led cash transfer across geographies. So if you could please demystify that. We just have 5 minutes, but you can please proceed.
No problem. Firstly, it's nice to be with you all today. What I'm actually going to do, because we are a little short on time, but I'm going to put the links to two key documents to help talk about this in the chat. First is a blog linking to the paper that ChristianAid wrote a while ago, and the second is a report that came out from the Cash Learning Network, which emphasizes this divide as well. And I think actually this is a really nice segue from Monisha and a lot of the stuff that was said by the other panelists. But Our key definition is that these two things are different, but not in tension. So our assumption is that locally led is where the local actors are very often those really rooted in the community. So definition of civil society-based local actors really hold the design levers so they can choose transfer values and mechanisms. So there's a lot that overlaps, a bit like what was being said by Monisha about cash in envelopes sometimes to help smooth out where those bigger systems don't work. So locally led is about the system itself or bigger institutions supporting what is already happening. Localizing, on the other hand, is where we are aiming to make some of those bigger systems more locally accountable. So that's like what we were hearing from Aftab at the beginning about those big UN systems having more local active voices in them, but more in the India context, again, what we've been learning from the study that was run about how government systems can lean on local actors' expertise and knowledge. And again, what was also said about using those new digital resources to send money more quickly to local actors and integrating them more fully. So the key is that these are two very different things. One is about big institutions supporting what is already spontaneously happening. And then the second is those big institutions in themselves becoming more locally accountable. Our framing is not to say that one is better than the other, and we see complementarities, and I think that's where picking up where the conversation was dropped actually from Monisha on that. A lot of this is intangible. It's quite hard to draw an organogram chart with a hierarchy which says that this person gives this person the money. I was really interested in all of those points that were just made about greasing the wheels or making this happen. It's about helping people fill the form. It's about finding those that have been marginalized and excluded. It is about those practicalities of reopening the bank accounts, and having flexible funding available for local actors to also fill gaps of their own. I know we're over time, so I'm going to stop there. There is more to say, obviously, on the subject, but I thought a number of the points from all of the panelists were really, really interesting. And yeah, I've just dropped the 2 links in the chat, which shows sort of our global thinking and the work that we've done with Henna and the study is also trying to apply that much more bespokely in an Indian context, basically. So with that, I'm gonna stop there because I know I will be keeping you from
Thank you
other
so
meetings.
much, Bhatt. Thank you. That was a very nice way of concluding this. But Eshani, would like to hear from you on my question. If you could quickly respond. Yeah.
Thank you so much, Dr. Henna, for raising this question. So maybe I would just like to point out the fact that recently, I also came across a paper where the Center for Financial Inclusion actually created a causal linkage between, cash transfers and gender-based violence along 3 pathways. So where the study actually highlighted that increasing access of cash to women can actually result in economic security and emotional well-being at the household level as well as at the community level. So this is something which we have also, like in my first half of the presentation, I had highlighted that when women have control over cash, it not only helps give some of the important like household food security, education, health, all these important social indicators are given importance, but at the same time it also helps in reducing negative coping mechanisms. But then again, on the other side, contrary to that, there are also instances where it might threaten the male members, which I have mentioned. But then there are ways of mitigating this, wherein humanitarian stakeholders, local stakeholders, along with NGOs, should be working actively with the community, and this should not only be limited to engaging with the female, but as well as their male counterparts, to enhance and to break the rigid gender norms. So that is where this I think your point was very, very valid, though I am not sure if I'm able to answer the point that you have raised fully. But then yes, there are both negatives as well as positives. And as I said, that there are also evidences where flow of cash is reduced intra-household dynamics. Conflicts have come down because now they don't have to rely on other mechanisms, and basic needs are being met. But at the same time, there are also there are some aspects where the flow of money can also lead to channeling it to purchase maybe items which are more tempting, like purchasing luxury items, or maybe misusing it, misappropriating it for some other purposes, be it substance abuse, be it using it for other illicit work. Like we usually see this in conflict affected areas, where the flow of cash is restricted because we don't have the monitoring mechanisms. So under those circumstances, I think one of the participants, Anjanda, had very rightly mentioned about the use of e-vouchers, cash vouchers, and this is something even ADRA, in our field implementation in Manipur and Mizoram, we have adopted this because we are mindful of the security risk, the challenges that direct flow of cash might result. And this is where we try to we have brought this component of cash vouchers, wherein the market is brought to the settlements, and women and other community members do not have to take this additional, they do not have to go all the way to the market, which might be very far from the settlements that they are located in. I hope I have been able to respond to
Thank
your
you. Thank
questions.
you. It is more detailed response than I was expecting. Thank you so much, Eshani. And we have some questions. Anjanda's question has also already been responded, but I would request any of the panelists if they would also like to respond to, or Anjan, you want to come on the mic. We also have somebody else. Do we have more queries, Krupa, other than Anjan? Anjan Mitra. Can you unmute your mic, Anjan? You have raised your hand just in case you want to make a submission.
Good afternoon, madam. I have a small suggestion to you. You have sent the link to us after registration. But when we log in the program, we have to submit the information, most of the information again. Is it possible for avoiding that process?
Thank you so much for your feedback. I would pass it on to the Spear team. I'm sure they've taken note of this feedback, and we would be coming back to you with, Spear would be coming back to you with the right response
Thank
on
you,
this.
madam.
Sorry for the inconvenience caused. Any other questions do we have? Anybody? Loy was here. Loy, would you like to unmute your mic?
No, I've asked my question and I basically want more information. But more importantly, if I just emphasize what I've written, how do we link local actors with local government? And when I say local government, I don't mean the appointment of the state or national governments, but the local elected officials who are partners of the communities. So how do we build partnerships? And how do we continue beyond the time of the project?
Thank you so much, Loy. I think this was partly, mentioned by Mihir in his, submission, where he was talking about, the building of an collaborating, coordinating, and, also working alongside the, the civil society organizations. Now, with this study, with this learning study that we have done in Andhra Pradesh, government has taken a keen interest in understanding how these cash transfers have happened in the past, for example, 3 or 4 years, and trying to understand that through a social protection, mechanism and approach, how we can increase and incentivize more number of families in terms of the humanitarian cash transfer. I think the answer would be largely creating more rapport with the local government administration and keeping them more aware about the work that is happening, seeking complementarities, and then devising common guidelines or action plans or action frameworks of how to work together. Of course, this is a nationally driven, so long as your act and your SDRF, NDRF norms do not lay out these particular guidelines, they will not be adhered to at the subnational and local level. But for that, I think we all need to work together to bring in those complementarities. I would request any other panelist if they have any other any additional points to what I have just responded to, Loy.
And if I may come in, I think you have very aptly put together the fact that having sharing what you are doing, I think in Andhra Pradesh specifically, the government took interest because you were able to communicate very clearly about what you are as an organization doing, what is your presence, how is your presence making a difference. And even when we talk about a long term impact, we might have our aid or our action is there for a few days, few months, and max a few years, maybe 1 or 2 years at max. But then if we are able to establish those relations with the local authorities, specifically like the district collectors, it's as simple as going and telling them about what is happening and where is it that you want to pitch in, and I think they are very receptive of any sort of support that they get. So it also largely depends how we are communicating and listening with the departments or with the various local authorities. And that makes the whole shift from like being very isolated and working in pockets to actually working together and being able to sustain your efforts. And this also gives for organizations, there's a leverage that you get a lot of recognition from the government departments, which is a win-win situation for all. So those are very simple steps, but they make a lot of difference.
Thank you so much. Anybody else? Thank you so much, Loy, for that very interesting, very important question. But we intend to devise these guidelines, and the draft of these guidelines will be shared with all the participants who joined today's session, and maybe a wider humanitarian practitioners group through SPEAR. And we intend to kind of, have a bigger, workshop maybe at the national level sometime soon in the coming months, to kind of see how best we can put our best foot forward by coming out with a draft, SOP or a guideline for one of the state, which can be replicated in other states if the national government, along with the relevant ministries, as I said at the outset, that this is also talking about the social protection ministry, the social justice ministry, social welfare ministry, a disaster management ministry, and a whole lot of other ministries. And in India, we have a lot of schemes. So how do we, integrate all of them? And thank you all for being a part of today's session. It's been a privilege listening to all of you and learning from your wisdom. We intend to work together with this wider group and share the study with all of you, of course, with the draft guidelines and the draft SOPs that will be developed for the state of Andhra Pradesh, for your expert insights and inputs, which will enrich that document before it goes to the national government for a consultation, which we will keep SPEAR and all of you informed about. I would hand it over to Krupa for a vote of thanks. Thank you.
Thank you, Dr. Hina. This is Abhay from Aparajita, and we are working in remote district of Uttar Pradesh, that is Bahraich. Bahraich is just like a bowl and it is disaster prone. And during monsoon season, the community which are just situating at the bank of river Saryu and Ghagra. So can say ki with the coming of monsoon season, a fear born, new fear born in the heart of those people. And what we are this is a very good initiative. The session which was organized by Sphere, and the panelists shared their opinion and things and studies and experience and all things what they found in their research studies on or on the basis of their work at ground during the humanitarian response. I would suggest, and I'm not here to suggest that, but I would suggest and request a Spear team just do something just on the basis of ground things, what the things are going. So we need to go on the C-trip and things, and we just need to can say ki organize a session on C-trip that how the situations are going to change in prone areas in the districts like Bahraich and other districts which are just where the can say that the rivers are linked rivers are there and they are coping with different disasters. During flood, as we know, lots of disasters are taking place, which are now are set in the guideline of SDRF and all things. So we should go in that scenario also. And एक मैसेज मैंने देखा, I just found a message in the chat box कि we need to set up some groundwork also, and if possible to link with other agency to just organize trainings on ground will be very fruitful for those communities who are living at the bank of the rivers. So thank you, Dr. Thank you, Hina, and I hope when I started my work, I met you in Gorakhpur, if I'm not getting confused, in Hotel Vivek, and it was very interesting session by you that time. So thank you.
Thank you, Abhay. Thank you. Due to paucity of time, we will have to stop you and hand it over to Krupa for the closing. Thank you.
Thank you. Thank you very much.
Thank you so much, Henna ma'am, for very graciously taking the conversation and hosting the panel discussion with us. And thank you all for joining us for this very important discussion. All the PPTs shared by the resource persons and the materials shared in the chat box throughout all the very nice engaging conversations will be shared to the participants via email very shortly. Please take a moment to go to the chat box to find the feedback link and drop your feedback about the session. And if you would like to have us host any other important topic of discussion, can also be done. Thank you so much. We'll meet you in another session.
Thank you very much. Thank you.
Ma'am, participatory process in can you provide the certificate for all person who are joining your meetings and trainings? Because many of the organization and donor agency need, if you have any certificate on that issue, I will support you.
Yes, sir, we understand. If you require
Because
a certificate of participation.
SCL also open our beats and they asking about the experience and other, because I have done training from SPR before 10 years, 15 years last.
Yes, sir, we understand. We are very well noted. We can drop an email requesting for a certificate of participation to Sphere India Academy team, and we will work on it and get back to you.
Thank you.
Mr. Ranjan Mitra, your query will also be answered by the Sphere India Academy team via email shortly. Thank you so much, everyone.